Hi, everyone. Thank you for joining. We are just going to give everyone a few more minutes to sign on, and then we will get started. Hi, everyone. I just wanted to thank you again for joining. I am Miriam Khan. I am the Communications Director at Gradient Health Systems based in New York. Um, Again, just wanted to thank you all for joining our product webinar. I know it's been a little while since we've done one, so excited to get back on track and get these started. Just before I turn it over to our moderator and our panelists, just some quick housekeeping announcements. As you know, if you've joined before, this webinar is being recorded. We will share a copy of the recording following the webinar. If for some reason you don't receive it, it will be on our website, gradienthealth.org, under the training page, or on our YouTube channel if you search Gradient Health Systems. If you have any questions during the presentation, we will have a Q&A at the end, but if you have anything during, feel free to use the Q&A feature at the bottom of your screen or use the chat function as well. We'll give everyone a chance to speak at the end if they have any questions they'd like to ask in person afterwards when we have Q&A. For now, I will now turn it over to our moderator, Dr. Ndaba, to do an introduction and get us started on this webinar.
Thank you so much, Mariam. Let me just confirm if I'm audible.
Yes, you are.
All right, thank you so much. And once again, welcome everyone to this yet again another very exciting discussion. And thank you so much once again for all of you that have managed to join us. I'll quickly like to introduce our presenters and let alone the panelists. So we have Dr. Hamida Hassan and Dr. Shedai Salim, both practicing anesthetists from Tanzania, who will lead the discussion. And then on the panel, we have Dr. Sweetbet Ansbet, physician anesthetist from Tanzania. We also have Dr. Papicho Ntambwe from Livingstone, Zambia, as well as myself. My name is Dr. Spukandava. I'm an anesthetist from Zambia. So very excited to discuss one of not so common topic, but very, very important, which is humidification systems during mechanical ventilation. And I know that all of us who are practicing either in theater or ICU emergency departments, you've actually dealt with the issue of humidification during mechanical ventilation, something that a good number of us may not pay attention to so much, but very critical, as we would hear during this presentation. So it's a very important topic, very exciting topic. And like Mariam had mentioned, please let's feel free to interact at the end of the presentation. Share your personal experiences, your views, your opinions. Once again, you know, humidification is a very, very complex topic. So we have decided to pick, I think, the most important areas of the discussion. So quite a number of details may be omitted during this discussion to confine the presentation to the specified timings. Running through the outline, so we are quickly just going to look at the overview of humidification, where we define and explain what humidification is, and we'll quickly jump to discuss the role of humidification during mechanical ventilation. And then we'll talk about the types of humidification. Here again, we'll try and focus on the most common ones that most of us have encountered in our practice. And then I will conclude by discussing, you know, the setup for humidification systems. Where do you find them? Where do you place them in the ventilator or on the anesthesia machine, for example? And then we may go into some technical details as well as far as humidification is concerned. Again, sparing you of the complex details. Hopefully, we'll have a wonderful discussion at the end of the presentation. Thank you very much. At this point, I would like to invite our first presenter, Dr. Hamida Hassan Chande, to take us through the first part of the presentation, and then she will later on hand over to the second presenter. Thank you so much. Dr. Hamida, you're welcome. Thank you.
Good evening, everyone. I hope you all can hear me.
Yes, we can hear you.
Yes, we can hear you.
Okay, so I'll take you through the first part of our presentation. To start with, I'll start with the polls. There are only going to be 2 polls. So the first poll goes with the question of which of the following is the benefit of humidification systems during mechanical ventilation? A, maintaining patent airway. B, preservation of body temperature. C, patient comfort. D, prevention of airway injury. And E, all of the above. So, any volunteers to answer the first 4, please?
And feel free to raise your hand if you'd like to answer, or you can write it in the chat as well.
Anyone there? So we can make our discussion an interactive one. We'll see the answers at the end of the first part. So anyone to answer the first 4?
Darso, I see that you are that you'd like to speak. Please unmute yourself and speak.
Yes, good afternoon. My answer will be B, preservation of body temperature.
Okay. That's your answer. Okay, thank you. Anyone else?
Can I just say that the chat is muted? It's disabled.
Oh, thank you for that. I will update that, but feel free to speak. Thank you.
Any other answer from the participants?
Me, I'm raising my hand.
Okay, please give your answer.
To prevent injury of airway.
Okay, thank you. Thank you for your answer. Do you have anyone else, or we can just move to poll number 2?
I think there's still 1 or 2 hands raised. Maybe
Okay,
give 1 or 2 a chance, and then we move on to the next poll.
okay. Another participant to answer?
Okay, I think the answer should be all of the above. E.
Okay, thank you. Daba, you said there are 4 hands. Another one? The 4th hand?
Maybe the last one.
Yes, yes.
Yeah, kindly unmute your microphone and give us the last attempt.
Hello,
Anyone?
can I be heard?
Yes,
We
Tafa?
can't hear you. Mhm.
Yes, can I be heard clearly now?
Yes.
Okay, I think I agree with the last speaker, all of the above.
Okay, thank you. Thank you all for answering the first poll. Next slide, please, for poll number 2. So poll number 2 goes, which of the following is not an ideal property of a humidification system? A, ability to warm and humidify gases to physiological conditions. B, no additional resistance to gas flow. C, does not generate heat. D, no additional dead space. And E, no additional risk of infection. Anyone to answer?
And just to say, feel free to raise your hand as well, but the Q&A feature, you can answer there as well, since the chat is not working for panelists.
Okay.
If you have your hand raised, please feel free to speak. You should be unmuted.
Okay, no additional dead space. Thank you.
Come on. Nenda. Ufanye mshemishi. Haina no.
Okay, thank you. Any other one to answer? The last one, at least, so we can move on.
Okay,
C,
mine is
does not generate.
C. Does not generate heat.
Does not generate heat. Okay. Thank you. Okay, Ndaba, we can move on to the next slide. And we'll discuss the
Go for
answers
that.
later. Okay. So in mechanical ventilation, the whole process of adding moisture to the air, or when the gas mixture is being delivered to a patient through a ventilator or anesthesia machine, is what we identify as humidification. And it is recommended for all patients who are on mechanical ventilations for the air to be humidified. And for professionals, for healthcare professionals, it is important for them to understand the types of humidification systems and the importance so that they can provide the optimal care to their patients. And as Ndaba said before, the whole process of humidification is still an ongoing discussion for critical care physicians and anesthesiologists all over the world. So as we go on, we can see there are studies which others prefer to use this type of humidification system, others prefer another one. So it all depends with what they prefer for the required patients. Next slide. So what are the considerations for choosing a humidification systems? One is temperature control. So the temperature of the humidified gas should be carefully controlled to prevent either hyperthermia or hypothermia for the patients. And also humidity levels. They are typically, the ideal humidity level for mechanical ventilation is supposed to be between 30 or 60%. So either less than 30 or more than that is not considered ideal, at least. And for the humidification systems, they need to be maintained regularly to prevent bacterial growths, such as which can lead to infections such as ventilation-associated pneumonia, and also to ensure the proper function of the humidification system. Next slide. What are the clinical applications of humidification? One is in the ICU, especially because most of ICU patients are on mechanical ventilation, either invasive or non-invasive. So humidification is mostly used there, and it is also recommended, as I said before. And another application is in the operating rooms. For patients undergoing surgery, it is safe for the air to be humidified for comfort, to maintain comfort and safe respiratory conditions. Also, another application is in respiratory care, mostly for patients who have who use oxygen as part of their daily life. So the air needs to be humidified to prevent complications. And yeah. Next slide. What are the benefits of humidification? One is to maintain a patent airway. And in maintaining a patent airway, we can prevent the dryness of the airway, which could cause discomfort or the damage to the mucosa or even inflammation. So humidification helps to prevent that. And also in the whole mechanism of mucociliary clearance, humidification helps to maintain a very normal function so as to remove any secretions or debris in the airway. Next slide. More benefits. Another one is to reduce complications such as bronchospasms. When the air entering the body is not warm enough, it could cause airway spasms such as bronchospasms, and also to reduce other complications such as atelectasis, and also to prevent hypothermia, because when air enters and it is not humidified enough, it causes hypothermia, especially for pediatric patients. And also another benefit is to improve comfort to the patients, because when patients are on mechanical ventilations, others have anxiety or they're not comfortable at all. But when humidification is used, they at least provide comfort for them, and also to improve the quality of their sleep, especially for those who depend on mechanical ventilation or at home or even in the ICUs. So it improves also the quality of sleep to the patients. Next slide. So what are the ideal properties of a humidification device? This could answer one of our polls, I think. Yes. So one is the device should have the ability to warm and humidify gases to physiological conditions. And two is there should be no additional resistance to the gas flow. The third one is there should be no additional dead space. The fourth is no additional risk of infection to the patient, especially for sepsis and ventilation-associated pneumonia. And another one is for easy and safe to use. It should be easy and safe to use. And last but not least, it should be cost effective. This I think lies mostly for us. It needs to be cost effective for most of our hospitals to afford it. Next slide. So types of humidifiers, we have passive humidifiers and active humidifiers. The passive ones, they utilize the patient's own temperature and hydration, and they achieve humidification in successive breaths. They also do not require any external power or water supply. And one of the examples of passive humidifiers is the HME. The HME works as the patient exhales, the exhaled air enters, passes through the HME, which captures the moisture and heat from the air. So when the patient inhales the air, as it passes through the HME, the moisture and the heat that was retained in the HME hydrates and warms the air as it enters the airway. So that's how it provides humidification. To move to the active humidifiers, these ones, they need an external power and water supply. They consist of humidifier and the delivery system, which adds water vapor to the gas flow independent of the patient. Some of the examples of active humidifiers include bubble humidifiers, nebulizers, and heated humidifiers. Next slide, please, to see here are the different types of the active humidifiers. We have the bubble humidifiers, the passover, which uses the wick and the membrane, the counterflow, and the inline vaporizers. All these are active humidifiers. Next slide. Also, the heated humidifiers, others have heated wires and others have heated humidifier and condensation. I'll speak more on the humidifiers with heated wire. I think most of the practitioners here, the anesthesiologists or the critical care physicians, they prefer the heated wires, the humidifiers with heated wires, especially for pediatric patients, because it provides enough temperature in the airway, and also it prevents hypothermia. It works more better than the ones with condensation. And the performance of the humidifiers may be affected by the room temperature and also the patient's minute ventilation. And so these humidifiers are supplemented with automatic compensation systems so as to compensate the increased ventilation that was there. Next slide. So how do we select the appropriate humidifier? For one category is to look at the humidification performance of the device. So, for example, if we look at the heated humidifiers, they should provide an absolute humidity level of between 33 and 44 milligrams of water per liter, while the HMEs, they should provide a minimum of 30 milligrams of water per liter. So you can see there how the performance works in those two types of devices. And another thing to look up to for when you're selecting your appropriate humidifier is the effect on ventilatory mechanics. When we look at the HMEs, in many studies, they have concluded that HMEs increase dead space, which in turn causes a decrease in alveolar ventilation and increases the arterial carbon dioxide tension. So as to keep the same level of alveolar ventilation, the tidal volume has to be increased, which may lead to volume-induced lung injury to the patients. And the HMEs also may increase inspiratory and expiratory resistance, which contribute to the development of the intrinsic PIP. So it all depends with what your patient needs. And another category to look up to when you're selecting your humidifier is the association of the device with ventilation-associated pneumonia. Previous studies have said maybe HME has more to do with ventilation-associated pneumonia compared to the heated humidifiers, but the current studies have shown no difference between the two. So I think when you're selecting the appropriate humidifier, it just depends on patient selection. But for HMEs, it's probably mostly better to be used in non-invasive mechanical ventilations. And if the patients are intubated with ETT, or if they're using the tracheostomy, it's better to use the heated humidifiers. And just to go through, these are some contraindications here for HMEs. One is patients with thick or copious secretions. They are contraindicated to using them. When there is loss in expired tidal volume, like in patients who have leak in ETTs, in patients who are managed with low tidal volumes, like those who have ARDS, in difficult to wean patients, and those with limited respiratory reserve, hypothermic patients with body temperatures of less than 32 degrees centigrade, as I've said before, the heated humidifier with the wires are better to be used, and in patients with the high minute ventilation volumes of more than 10 liters per minute. Yeah, I think that's all for the first part. Or maybe we can go to the next slide so we can see the answers to our polls. So yeah, congratulations to all the ones, I think 2 of you who answered all of the above. Or which of the following is the benefit of humidification systems during mechanical ventilation? So to maintain a patent airway, you preserve the body temperature for patient comfort and prevention of airway injury, as we have seen in the discussion. So all of the above was correct, but also the ones who say to preserve body temperature, they're also right as well. Yeah, and go to the next poll, see the answer. Yes, I think one of you answered does not generate heat. That was the correct answer for which was not the ideal property of humidification system. So for humidification system to be ideal, as we have seen before, it has to have the ability to warm and humidify gases to physiological conditions. It should not have additional resistance to gas flow, no additional dead space, and no additional risk of infection. Thank you all for listening. Thank you.
Yeah, thank you so much, Dr. Hamida. That was a very excellent presentation, and also just to commend the participants so far for the high level of participation. So even as we proceed to the second part of the presentation, please let's maintain this high level of participation to keep the discussion live. I just also want to quickly recognize that our senior anesthesiologists or anesthetists who have logged in. I think we'll recognize your names once this session is over. Thank you so much for joining in. So at this point, I would like to invite Dr. Shedai to come and take us through the second part of the presentation. So Dr. Shedai, the floor is yours. Thank you.
Thank you so much. Good evening, everyone. I hope you can hear me.
Yep.
Hello?
Yes, we can hear you loud and clear.
Okay, as I've been introduced by Dr. Ndaba, my name is Dr. Sheidai. There's an I on SHE, there's I. My name is Dr. Sheidai, an anesthetist from Tanzania. So I'm going to take you through the second part of the presentation as it has been shown on the outlines. Next slide, please. Okay, we will start with a poll in which it will be good if you will all participate. The question states that, which of the following statements is correct? A, heated humidifier should be connected on the expiratory limb. B, HME type of humidifier should always be connected during ventilation. And C, when heated humidifier is connected, there's no need for HME type humidification. And D, HME type humidifier can be washed and reused. The floor is yours to all the participants. Anyone can raise the hand and give us the answer.
The answer is B. The new type of humidifier should always be connected during ventilation.
Okay. Another response?
I'd like to say C, it would be dangerous to connect a HME type filter if the humidifier is heated.
Sorry, come again?
I'd like to say C, there's no need for HME humidification if a heated humidifier is connected.
To me, the
Okay.
answer is C. When heated humidifier is connected, there is no need for HME type of humidification.
Yeah. That's the correct statement.
That's nice. So you will, we will see the answers we go through the presentation. And at the end of the presentation, you'll also see the correct answers. Next slide, please. Another question, which of the following statement is correct? A, active humidification system with a heated wire self-regulated temperature delivered to the patient. Active humidification system without a heated wire tend to form condensed water in the breathing circuit. And C, active humidification system requires electricity to operate. And D, distilled water is the most ideal for use in humidification system. E, all of the above. Hello? Someone to respond to that? You can unmute
My
yourself.
answer is distilled water is the most ideal for use in humidification system.
Come again, Jason?
Answer is D. Distilled water
E.
is the most ideal for use in humidification system.
For me, the answer is E. All of the above are the answers.
Thank you, Paul. Thank you, Jason. Who else
I'd
can
like to
respond?
say E as well.
Yes, David?
I'd like to say E,
You also say E.
definitely.
Two more response. Two more response to this question. Which of the following statement is correct?
E, all of the above.
Thank you, Tafa.
You're
The last one.
welcome.
I'll go for E, all of the above.
Thank you, Chipo. So now let's pay attention to go through the presentation. I think through the presentation, you will all get the answers. Next slide, please. Okay. So we are going to see how do we set up the humidification. As the previous speaker has already explained the difference between active and passive humidification. As we have seen on the previous previous presenter, it is important for all practitioners, especially in ICU and in theater, to be competent in setting up the humidification system, as we have seen the advantage of doing humidification when we are ventilating the patient. So depending on the mechanical ventilator you have, we have different humidification exist. So you have to be competent to use all type of humidification. So you have to know also how to assemble them, how to assemble and pre-use check of those humidification, and ensure the patient safety during mechanical ventilation is the key feature. So next slide, please. So as you can see on the pictures, I'm not sure if you can see my cursor, or should I don't know, what should I do? So
But we can
as you
see.
see, you see my cursor?
Yes.
Okay. So as you can see on this picture, as from the previous speaker, you can see here from where my cursor is, this is an active humidification in which there's this an inspiratory limb connected to the humidifier. And then this is going to the water trap, and then it's going to patient. So this is an inspiratory limb. So from the previous poll, you can see that it's the first choice. It said it should be connected to the expiratory limb. So this should be connected on inspiratory limb, because what you want is the humidification to go to the patient. So as it's have been shown on the picture. And the second is HME. I think on this left picture is where you can at least see the HME. So the HME should be connected here, if you see my cursor, before the patient at the white piece, while the activities here close to the
Hello.
machine. Close to
Hello. Hello.
Yes.
Sorry.
Yes.
What I want to say, once you are explaining for us, just show the cursor where you are explaining, because your cursor is just trying to.
Okay, I put my cursor here. I don't know if you can see it.
You may go direct for the cursor. Where is it? We can see that this cursor is explaining what.
Here. Do you
Yes.
see it?
Yes. No, I'm seeing it is here. It is above.
No, it's not above. Okay.
Dr. Shaddai, you might be, I just gave you access to control the screen. Can you accept that? Did you get an up?
I did not get the request to control the screen.
Let me see if I can.
So try to put the cursor on the
you can see
on the oxygen cylinder. We see whether.
Yes. Yeah.
You can see. Now you can
Yes.
see.
We can see
Now I
there.
put on the left picture.
Yeah.
Do you see? Okay, thank you. So I will start again. So I said, as the previous speaker has explained, there's two types of humidification, active and passive. So this one here, you can see my cursor. Hello?
I'm not sure whether the cursor is behind, but it's all over the screen.
There's one cursor which is moving around, and there's mine, so I don't understand.
So we just be specific, madam.
There's one which is moving around, I see, and there's mine, which is.
But you are seeing yourself on. Just to continue.
Okay. So from the picture with the cylinder, it's where I'm explaining. Do you see my cursor there?
Yeah.
Okay. So this below here, the machine, the left machine, this is an active humidifier in which there's the distilled water is filled here. And then this humidifier is connected to the inspirator limb, and then it is going to the water trap, and then to the Y-piece, and then to the patient. This is active humidifier. And for HME, the HME is connected close to the end of the patient at the Y-piece. So this HME, it is not connected to the expiratory limb. So as you can see on the machine from the right side, from my right side, the one which has been labeled with numbers, here close to the test lung, it's where the HME is connected. Okay. Next slide, please. I am not sure if you could have been seeing my cursor. Okay. So this one is the pictorial presentation of HME, which is heat and moisture exchanger. So this is a humidifier which do a passive humidification. As the previous speaker has explained, that it works almost like a human nose, as it condenses the expiratory air, and when the patient is inspiring, so that moisture which has been collected here then is taken with the air, and the patient inhale the moisture air. So this type of humidifier is ideal for short-term and the transport of ventilation. And the good thing about it, it is portable, and also it has the ability to prevent infection. As you can see on the heading, that it is called heat and moisture exchanger filter. So it also do the filtering of the air, but at the same time it gives humidification. But it's also a single use. You can't use this from one patient to another. And also it helps to prevent contamination. And it should be connected on both expiratory and inspiratory limb. That's why in a previous slide, I said it should be connected at the Y-piece, close to the end where you connect to the patient. Next slide, please. Okay. So this is our machine. So this HME can be connected direct from these two poles, if you can see my cursor, as the arrows shows. So you can connect the HME here, but this HME is which is connected direct to the machine, it mostly work as to protect the machine. So the HME, which is connected close to the Y piece, it's more of the protection of the patient. That is the difference. But you can choose where you connect your HME. But for active humidification, this one which is filled with distilled water, this is its place. There's no exchange that maybe it is connected to the machine or to the patient, straight back to the patient. Should be here down the machine and should be connected to the inspirator limb. Next slide, please. Okay. So the active humidification, we said there's two types. The one without heated wire and the one with heated wire. So this picture on your right is show the active humidification system without a heated wire. This is common, especially in our setting. It's a common type of active humidification system, as it provides the power to heating element, and then the heat is controlled here at the number 1. You can see the heater. So you just control the temperature manually, the temperature which heat the water so that you can humidify the air. So this on the humidifier in which there's no heated wire means the temperature is controlled manually. So the disadvantage of this is most of the time there is a collection of water. Water is condensed and tend to accumulate in the breathing circuit. That's why if you have seen it well on the previous picture, you can see on those breathing circuits, there's some bottle which are collect water. So that water will accumulate there if you are using the without heated wire type of humidifier. So this, because the temperature is controlled manually, it requires a close monitoring of the temperature. To be close monitoring to make sure that the temperature is not too high or too low. So we are afraid that if the temperature is too high, you might cause injury to the patient. And this type is most commonly used in adults than in pediatric. Although in our setting, maybe if there's seniors, maybe they can give us their experience, because most of our setting, we have this type of humidification system, and we use both in adult and pediatric. Maybe if there's a senior participant can give us the experience of using this type of humidification system. Hello?
Hello, Dr. Yeah, maybe just to sort of quickly jump in and as anybody else would come through. Yeah, so I think excellent discussion on this slide also. And I know that for most of us who are practicing, this is one of the common and longest existing type of active humidification system, which doesn't have a heated wire in the breathing circuit. The other type it's actually a new technology, and we are seeing more of it coming up now. I know you would discuss, the advantages of the new modern humidification system. But personally, I think we've worked with this system, and generally we tend to would use it for both pediatrics and adults. We change the breathing circuits, and we use the smaller, we have those smaller humidification systems, the smaller water chamber that sort of reduces the dead space for a child. But depending on what's available, we would generally use for either type of patients. But of note, I think like you've mentioned, slowly this is becoming sort of an inferior system because we have something much more safer and efficient. The other point I think you mentioned, as I wind up, was the issue of loss of temperature and humidity as fresh gas approaches the patient's airway. Because remember, there's no heated wire. So as fresh gas approaches the patient, with this system has a tendency of losing temperature as well as humidity, which makes it a little bit, inferior. So yeah, I thought I add that, unless anybody else would like to add another experience. Thank you so much, Doc.
Thank you. Someone else would like to add something before we move to the next slide? Okay, next slide. I think maybe they will comment at the end of the presentation. Okay, so now we come to the second type of active humidification system, in which this is an active humidification system which has a heated wire. As you can see on the lower picture with the gray wire, so this is a wire which is connected to the humidifier. And the good thing about the heated wire type of humidification is that it has thermometer, so it can auto-regulate the temperature. And that's why they recommend it in pediatric, because mostly we are afraid in pediatric of hypothermia because of those breathing circuits. So by using this heated wire type of humidification, we can avoid loss of temperature and loss of moisture, because the temperature is automatically regulated through the thermometer, which is located at the heated wires. So its components include heater, humidifier chamber, temperature probe, heated wire in a breathing circuit. So although this one is more complex, but it's efficient and safer type of active humidification system compared to that without heated wire. Next slide. As you can see on the picture, although the picture seems a little bit blurred, so you can see this two wire connected to the humidifier. Dr. Ndaba, hello?
Hello, Dr. Shaddai.
Yeah, I see like the picture is becoming like blurry. I'm not sure if you can see.
Yeah, not very, very clear. Yeah,
Okay.
but I think it's just demonstrating the connections, the additional connections you make for this type of humidification system, which the temperature probe, as well as the connection for the heated wire that runs through the circuit. So those are just the two connections that are yeah, thank you.
So as you can see on the picture, as Dr. Ndaba has said, so the connection is almost the same as that without a heated wire, but this one, there's additional two wire. You can see on your right side, these two wire are connected to the humidifier, whereby the one is used for to heat and the other one is to control temperature. It's like a thermometer. So it's more precisely control the temperature and the humidity delivered to the patient. And it's best, as we said previously, in adult, because it also has an alarm safety system, which will show you if there's a low water in humidification chamber, or there's any disconnection, or there's lack of gas in the flow circuit. So this is advantage of it. So you don't need that close monitoring, as you can see the alarm, so it's easy for you to go and troubleshoot the alarm. But its maintenance is costful. Next slide, please. Wow, this is nice. So this is the front pictorial presentation on the left picture showed how the active humidification with heated wire looks like. So you can see at the front, it's almost like that of without heated wire. But the addition is, you can see on the side, on the right picture, there's 2 places to connect the wires. That's why it's called with heated wires. But other connection above, it's the same as that of without heated wire. I think this is the end. We can see the answer of the polls. Okay, so poll number 3. So the answer, all of you who said the answer is B, that was the correct answer. HME type of humidification should always be connected during ventilation. So maybe at the end of, during discussion, we can hear experience from different people. Next. And the last poll, which is poll number 4, the answer is all of the above. So as you heard, active humidification system with heated wire self-regulate temperature, we say that active humidification system without heated wire tend to form condensed water in the breathing circuit. We say that you will see on the water trap, there will be collection of water. Sometimes the water can be seen on the breathing circuits. And the active humidification system requires electricity to operate. And distilled water is always an ideal to use in humidification system. So the answer was all of the above. Next slide. Okay, so in summary, humidification is an essential process in oxygenation therapy and mechanical ventilation, as it will also be protecting the patient airway. So lack of humidification of fresh inspired gas can lead to serious complication and poor patient outcomes. Various humidification systems exist and differ in terms of application, complexity, and efficiency. So it is absolutely essential for respiratory care provider to understand the role, the diversity, and setup of humidification system during ventilation, and also to do close monitoring of the performance of the humidification system during ventilation is the key to ensure optimum respiratory therapy and to prevent complications. Thank you for listening.
Wow, thank you so much, Dr. Shedai, and indeed Dr. Hamida, I think for the very precise, wonderful presentations. And then, like I mentioned earlier, this is can be a complex topic. We can discuss the whole day, but I think the presenters have really tried to bring out the most important highlights of this conversation. So thank you so much to the presenters. So at this point, we would like to open the floor for questions, sharing of experiences, or any clarification related to this discussion. I would like to invite Jory Othman. I think we held his call to speak during the presentation, but please, the floor is open. Feel free to unmute and make a contribution. Jory?
Hello. Yes, sir.
Yes, please go ahead, and then Jory will speak after that.
I'm Paul Cloudy.
Paul Cloud, yes, thank you.
Yes. I'm just thank you also myself for listening for your presentation. Was good, but what I want to say now is to apologize you to provide for us this PPT in the for our emails, so as we can learn more, because it is very important to know more, because once you listen only, it means that sometimes you can, or we are human beings, and you are not experts than others who are talking here. But what I wanted to say is to apologize to you as your facilitators to give us the materials. Oh, and for the another days, even this one you can give us also for our email, so as I can learn and the others they can learn to understand more. Thank you.
Yeah, thank you so much, Paul. Indeed, you will definitely receive an email regarding this discussion. Thank you so much for again joining our discussion, and I'm glad that you enjoyed.
I'm enjoying. Thank you.
Thank you so much. Right.
Dr. Let me jump in just to tell Paul that on top of that, this webinar will be available on Guardian website. The records and the PowerPoint will all be available, so everyone has free access to the material.
Oh, thank you. Thank you so much, Dr. Papicho. Grateful as I wait for any additional comments. Please, if we can't see your hand raised immediately, please go ahead and unmute and speak. We'll give you the chance.
Hello.
Yes,
Hello?
Jory. Yes,
Yeah.
we can hear.
Hello, everyone. Thank you for this good presentation. I have gained something because most of people we are not able to conduct this active humidifier. That's why we prefer to not connect the patient with an active humidifier, and most likely we use to connect with a HME. But what I can see is regular training on these things. Maybe it will help us to gain knowledges on how to use these things and the benefit of using these things. Thank you.
Thank you so much, Jory. That's a very valid point, and the exact reason why we thought we bring out this topic. It's one of the topics that would rarely come across, and so yet very, very important, because humidification. Without humidification, then you are definitely going to cause serious injuries during ventilation, and so it's a very important part of ventilation and critical care. So thank you so much for your contribution.
Sorry, in addition, can we use the two things at once? This active humidifier and HME filter?
Yes.
Are we supposed to find a bacterial filter?
Hello.
Yes.
Yes, we can hear you.
Thank you, Dr. Othman, for your question. Yes, we use both the active and the HME at the same time, because as I have explained earlier, the HME one, it acts as a humidifier, but also it acts as a bacterial filter. So we use both at the same time.
Yeah, also I have one experience here. One of my colleagues said that you may use 3 filter to the patients. You may use 2 humidification filter with 1 bacterial filter. How is it correct or it's not correct?
I didn't get when you say 2 humidification filter.
Sorry, 3 filter at once. 1 filter kept on a expiratory valve, the second kept on a inspiratory valve, and the third one kept on the patient side to the mounting catheter.
You mean the HME?
HME, yeah.
Yes.
With the bacterial filter.
Yes, you can use that.
Yeah,
Unless there's an experience, but I know you can use the 3. 2 connected direct to the machine and the other one to the mounting catheter. Because those connected to the direct to the machine, they more protect the machine.
Okay.
Yes.
Thank you.
Yeah, so yeah, I think to a good question, and to Dr. Shedai's comment, just to add, I think now there's actually a sort of people are being encouraged to actually, if possible, to get 3 filters connected to the breathing system, because remember the HME also serves the purpose of protection. You are protecting the vent on the other side to avoid moisture and water, affecting the ventilator system. And then on the other side, you are also sort of the bacterial filtration process can also help in infection prevention. And then there are certain machines that would have a flow sensor sort of near the patient's airway. And ideally the flow sensor which is near the patient's airway should not, you shouldn't have any secretions there, collection of other contaminants. It will affect its function. So you'll find others advocating to have an HME just on the Y piece, so that you can also help to protect the rest of the breathing circuit, including the flow sensor, which on certain machines you'll find them just near the patient's connection. So that is encouraged as well. Thank you.
Thank you too.
So whilst I think as we sort of begin to wind up, I would like to just pick a few comments from the chat box. Yeah, so I would read one from David Muir. David Muir
Sorry,
says,
Dr. Ndaba, just before you do that, we just have one more hand raised in the chat.
okay, please
Free to
go ahead.
unmute yourself, Richard.
Oh, thank you so much. This is Richard from Uganda. Yeah, my question is, are these active humidifiers accessories to the UAM machine, or they were brought recently? Because the UAM machine I have don't have these other active humidifiers, and I don't know if they are accessories of the UAM machine or if we have to buy them separately. Thank you so much.
Thank you so much, Nkuruniza, for that question. Any of the panelists to give a go, Dr. Sweetpet or Dr. Papicho?
Yes, Dr. Ndaba, I can jump in. Thank you, David, for your question. These active humidifiers, they are basically for the ventilator machine that you use in your ICU, either the ICV or the CCV if you have one of them. I know any other type of ventilator that is in the ICU, they use also those active humidifiers. But when it comes to your UAM, you use the HME. That's the type of humidification that will be ideal to use for ventilation. Thank you.
Yeah. Yeah.
Dr. Ndaba, there's a question or a comment on the chat box talking about how frequent should the HME change.
Okay. Maybe we allow Othman Jory to make a comment before we read some of the comments from the chat box. Yes, Jory. Okay. Yeah, please unmute. Go ahead and.
Okay. You hear me now?
Yes.
Okay, thank you. As you have been said, that this is a very good idea for the humidification of the patient. And what I recommend is regular training on these things, because I'm in the field and I see what we are doing here. So maybe if you get regular training, people understand the importance of doing this humidification to the patients.
Yeah, thank you so much. Well noted. Thank you so much.
Okay.
For that contribution. Yeah. So the comment from Joshua says, how often should HME filters be changed for a given patient? Anybody? How often should HME filters be changed?
Hello.
Yes, please
Hello.
go ahead. Hello.
Okay. It's me, Jory from Muhimbili, Dar es Salaam.
Okay, thank you, Jory.
Yes. So changing of this HME filter, it depends, but most of the time it's not more than 72 hours. But it depends if it gets water in the HME, you have to change another one.
Okay, thank you so much. That's a very precise response. Anybody from the panelists? How often do you recommend?
Ndaba, it's Hamida here.
Yes, please. Thank you.
Yes. I've seen in some studies they say within 24 hours. After 24 hours, you change the HME filter. Most of them recommend 24 hours. After 24 hours.
Okay.
Yeah.
All right. Thank you. So 24 hours. Sweetbet, you want to add a comment?
Maybe before Sweetbird comes
24
through, I
hours.
can just say.
I'll go with 24 hours. But in case the contamination, either with the circulation or whatever, because it will increase resistance. But I think 24 hours is ideally for our settings.
Okay. Thank you. Yes, Papito.
I just wanted to make to make a comment on that good question, and the answers made by the previous speakers are all correct. I know it's a challenge in our institution to have many of these HMEs available. That is why it leads sometimes one to go beyond 24 hours without changing the HME. It's because sometimes we do not have enough available at hand when ventilating the patient. So that push many of us in different areas where we practice from to go beyond that. But actually, sometimes when the patient is having so much secretions or vomiting, when the tube receives source secretion and then they pass through the HME, as soon as you realize like the delivery of your gas is not as you would like, the setup is not showing as you set it up on the screen, we can still change earlier than 24 hours. But limitation in availability of this tube or these HMEs, at times it will lead us to go beyond 24 hours, which is not the ideal. Thank you.
Yeah, thank you so much. Thank you so much for all the valid responses. I hope that answers the question we had on the chat box. So David says, IMHO humidification is a nursing issue. We choose and set up ventilators in critical care. We maintain the equipment and watch out for complications. We clean the equipment and store the equipment. The doctor is not involved. So that is a comment from David. Yeah, I don't know if there are any reactions to that. Yeah, so it really depends on the setting.
Yeah, speaking from the critical care perspective.
Yes, David.
Difference in anesthesia.
Okay. From the critical care perspective.
Definitely, yeah. Just
Yeah.
the doctors wouldn't be interested in humidification. Just wouldn't.
Yeah, but generally we should. Generally, I think in my ICU, the ICU critical care nurses do the setup, the testing, and the cleaning and everything. So yeah, but I think at the end of the day, when we have a patient we are ventilating, we should all be interested and just make sure that the everything is well set up correctly and the patient is safe. So I think the practice may vary from system to system depending on so many factors: human resource, the training, the level of training, competencies, etc., etc. Yeah. Yeah. Otherwise, thank you so much for that experience. As we conclude, I would again read David's other comment. When I spoke to Gradient Tech a few years ago, they suggested the HME should be changed every 6 hours, ideally as often as you can. I've read literatures which will talk about as frequent as 6 hours. Others, it just depends on your assessment. Is it still serviceable, or does it appear to be not functioning well? It really depends on on what is advised. Yes, David, you.
I just say a few years ago, the manual did say 6 hourly. But I imagine things have changed since then. No, nobody can do it 6 hourly.
Yeah, I think the other factor, like Dr. Papicho had mentioned, there are economic issues at play. Like, yeah, how many HMEs you have available to replace. You find that in our setting where we have challenges, you find one HME even going up to a week, which is not good. Yeah. So yeah, generally it depends on so many factors. Yeah. So I don't know if there's any other additional comment from any of the panelists or any of the senior anesthetists on the call as we conclude and wind up. The floor is open. I think we should be winding up in a minute or so.
Can I just say that I've seen so many dangerous things happen with HMEs that I much prefer the active humidification.
Yeah, correct. There's another question as we wind up. Another question from Kiando says, can a heated wire be used when electricity is cut off? Sweetbet? And the other question, as we think about that, can a heated wire be used when electricity is cut off? The other question here is that I think we can take these two. How much temperature should be set in a humidifier without a heated wire for a pediatric and adult patient? What are the temperature settings like? This one I'll ask Dr. Shadai maybe to come in, or indeed any of the panelists.
Okay, for the first question, which asked about the heated wire, I've never used the humidifier with heated wire, but I don't think if it can function without electricity, as even in the slide you explained that they need electricity to function. Although in my setting, I've never used that with heated wire. I have that without a heated wire. And another question is, how much temperature can you set in those without a heated wire? So most literature says that the temperature should not exceed 40.
Yeah, so
And
generally,
someone else can give us his or her experience, but per studies, they say the temperature should not exceed 40. 40 degrees centigrade.
Yes, yes. Others would say just a physiological temperature. The physiological temperature could suffice. So for the heated wire, you always need electricity. That's why you see the humidification chamber always has got its separate power connections, which you have to connect to the mains because you need to heat the plate for it to warm the water, which is in the water reservoir chamber. So I think you almost always, for now, you almost always need electricity to power the humidification system. So yeah, I think thank you so much. I can't see any further hands raised.
Tandaba, there's a question by Luciano asking about bronchospasm. Just down there. So she said in a situation of bronchospasm where the patient is connected to the ventilator, what are the immediate intervention and what mostly likely? Because, so though the question is a general question, which is out of a topic that we discussed, but maybe we thought we can just make few comments to say managing a bronchospasm, the first thing to do is to identify what could cause the bronchospasm. If you have secretions on this patient, depending also on the initial condition that lead to ventilation, if it's secretion, you make sure that you suction them and you remove them without traumatizing the airway. Gentle, smooth suctioning to take away all the secretions. And if the patient who's got, for instance, like asthma or COPD, they might need some steroid, some other bronchodilator drug that you can give them for you to kind of bronchodilate them. You can also think of adjusting your ventilator settings by reducing the pressure in the airway so that you make up a good ventilation strategy. So administration of bronchodilators can be done IV or you can inhale the patient, or those are different ways that you can treat your bronchospasm on the time of ventilation. Yeah, sometimes mouth sedation can also help to reduce or to clear the spasm that is coming up. And you get to see this spasm by getting your figures increase on the screen. There is high resistance in the airway when you're ventilating, so can lead you to that put together the initial condition of the patient. Yeah, so I thought maybe we could share with our colleagues a few means of treating bronchospasm on ventilated patients. Thank you.
Thank you very much, Dr. Papicho, for taking up quite a number of questions in the chat box. I wish we had all the time to go through all the questions, but I think in the interest of time, please we'll take note of the questions, and some of them we might respond via emails. Since we have your emails with us, we can write to try and explain some of the questions that you raised in the chat box. So in the interest of time, we'll end here. From me, I think it's just to thank everyone for the participation and the presenters also for the wonderful presentation. Thank you so much. At this point, I would like to invite Nkajima to just give us some closing remarks from Gradian. Thank you so much. Nkajima, or thank you, Nkajima, you can come through. Thank you.
Okay, thank you so much, Dr. Ndaba. But before I go for that, you said there is somebody want to say something. Do you remember?
Yes, sure.
I don't know who the doctor you said you want to thank him for his joining. I don't know if he's still around or not.
So thank you, Nkajima, for for that reminder. Yeah, so we will not recognize all the senior individuals present. There's Dr. Rigid. I've seen Dr. Rigid. Please, thank you so much for joining this conversation. I hope it was helpful for you and the team. Unfortunately, we were not able to address your question. We'll definitely write via an email. There are, again, a couple of senior anesthetists in the meeting. Please, we recognize your presence. We thank you so much for joining us. We really appreciate and are humbled. Thank you, Gajima. Over to you.
You're welcome. Okay. Thank you all for your vital time for participating in this session. And I thank so much Dr. Shedai and Hamida, plus the rest of the panelists and all the participants for your time to be with us here. And also I can say you can visit our Gradan website. You can see all the presentation as a poll, if I'm not mistaken, and the other guys, Richard, are they asking for this presentation? So you can go there and you can read it. And also, this is our business. So Gradient do this every Thursday. We have a clinical webinar and we have a product webinar. So we'll keep on posting this poster once we're preparing for session like this. So keep staying tuned. So we'll keep on update you when we have session like this. But in a month, we have 2, if I'm not mistaken, as our routine we do. So by saying that, I thank you all and hopefully see you next time. Bye.
Thank you so much.
Thank you so much. Bye, everyone.
Thank you.
Nice meeting you. Have a good day.
Yeah.
Thank you.